Good morning, everyone.
Good morning, ma'am.
So, a very warm welcome to all of you. And today, basically, we are here for Indo-Korean Knowledge Exchange Program. So, I would request Anshuman sir to please welcome our guest and also introduce her to us.
Good morning. Today, foundation is to speak in English because Miyoung should understand we are not abusing her, right? And when I visited South Korea, it's a warm hospitality. But what I found in the internet, the Korean people are very introvert and very arrogant. But one surgeon, Dr. Checher, he introduced me. See, Japan, arrogant. Korea, balance. If you are okay with him, remain okay. And Chinese, very cunning. I visited Park City Hospital and really warm hospitality, full of nature, mountains, green, cherry blossom, everything. Dr. Miyoung Kim, she came to India, stayed in Rishikesh for yoga training for 1 year. She understands English, don't forget Hindi, don't forget, and start saying something in Hindi. And after that, she did proper Ayurveda bachelor course, BA/MS from Bharati Vidyapeeth, Pune, and went back to her country, practicing pure Ayurveda for cancer patients. And that was honor for me when she assessed me, because I was not known to her, she was not known to me. Then her statement was, Susruta reborn for me. This is proud for me. Susruta, great surgeon, reborn. This is kind of honor and prestige they have for Indian system of medicine. That, and they are practicing Abhyangam, Sirodhara, Basti, Nasya, Virechan, all kind of Panchakarma for the cancer patient to decrease their side effects, but they never claim that they are curing cancer. See the dogma of our system, our Baba therapy, what they are claiming and what they are doing. Practicing pure Ayurveda, she brings all medicine from India, from Kerala, because she trusts company over there, and no hanky-panky, nothing, because I have seen myself. The whole idea is to share what she has been doing through our system in their country, how we can incorporate and start building. This is integration of the medicine, nothing else, that's all. And just as a formality, I ask Dr. Khanna ma'am to come over and welcome Miyoung. This is a kind of blessing from you. Good. Now I request Dr. Khanna just to honor Dr. Shanti Vadi. He is practicing Ayurvedic doctor, pure Ayurvedic doctor in Bhopal. She is also product of Bharati Vidyapeeth, Pune. Your finger is over the camera. Thank you. Now over to you, Dr. Miyoung. Share your experience, what you do. Dr. Shanti. We'll tell you.
Hi, namaste everybody. I'm really happy to to come in Anshuman and this hospital. Actually, I'm very lucky to speak about my experience in Korea. So actually, English is not my country mother language. So please understand me if I speak something else. But I will try to my best to explain very nicely. He explained me a little bit about me. Actually, 2004, I came India for study Ayurveda. But that time, actually, if you want to study that country some traditional medicine, you have to know about Sanskrit and that. So, first step is language was for me was very difficult because English is not my country language and Sanskrit, so it's not at all. So in first, I decided and I have to go to Rishikesh and then pure place and I want to learn yoga and same time I want to study Ayurvedic, English and same time Sanskrit some of it. And then after in 1 year and then I got admission in Pune and then I studied there like 9 years. So 6 years, 5 year half course I have and I studied more practicing there. So and I finished 2016 and then I go back to my country and then I started modern medicine hospital and then inside I made it Ayurvedic pure holistic Ayurveda center. So actually this Mocha city is in 3 hour from Seoul. Actually our having the group of hospitals, so actually main is in Seoul. But in Seoul hospital having also, we have operation theater and every department we have modern medicine. But in this, our CEO having the different states and different branches are there. So this is one of our branch in Gochang. So actually this area having not only village and we have like many actually sea around environment is totally we have nearby every 30 minutes we have sea, we have mud place and then we have something. Do you have a dolmen? Dolmen, do you heard about it? You never heard of it, like ancient style, that dolmen. 5,000 before and we stone and we mud there. Dolmen, right? Yeah. So actually in this area having most in this world we have that kind of dolmen in this area. That means in ancient time and this area was having good for to living the humans because and why our group CEO chose this area because it is east in Korea actually. First step is air is very highly have quality and then pistons you heard about
Want to know AQI of this area? Question? Huh? 0, 1. 0 or 1. This is a mountain. This is hospital, entire city. And what she was explaining, stone and water is warm.
Yes, hot water spring.
Hot water spring, like Rajgir.
Yeah.
Rajgir, hot water spring in the center.
Actually, this is actually not only, actually this is my hospital, two health hospital, but actually this whole area is our group actually. So he bought this whole area. Actually in our hospital have concessions itself. So he made first this hospital and he made seniors, seniors group, old age people.
Yeah.
Yes,
Senior living.
They are living here and nearby hospital. And then we have here very big Germanian jacuzzi, kind of very huge. It's coming from natural because this area having the mountain have the stone is very special stone, so it's coming very naturally coming warm water from the ground. So we have this very big spring water, hot water coming. So we have this spa kind of, and we have nearby here like a resort park kind of. So here we can patients also can stay, or otherwise the family also can stay, or any tourists they can stay here. And even here also we have Machakrama Center, and we have for cancer patients, and we have separately jacuzzi and every facilities here also this area. And then we have golf club here. This is actually golf club. So 18 hole we have. So this is golf club, and this is like golf player, and they are staying there. Resort kind of we have. And then we have this area. We have all climbing mountains and some temple and everything we have. So everything here show and market, and this also like kind of a department.
So this is all is actually hospital. Actually, I can explain our hospital is not only inside this constructions because we use. Can I change it? We use, actually this is hospital and this is like a
Generic.
emergency, generic
Emergency
only.
generic.
Yeah, but this only we can stay like longer, like
Geriatrics.
till like
Elderly,
old age
elderly.
and senior age they are admit here until whatever they can admit here. So we have now two.
Rehabilitation center for the senior citizens as well as for the treatment.
Yeah, so actually this is the main, and then in this inside third floor I have on my Panchakarma center. Yes. Actually this is we made 16 when I was in 2016 that they don't understanding what is Ayurveda, so they want to see how I'm practicing. So I was just first I was very small room I started, but patient coming lot, and then we developed every year. So now we make in third floor just beside the dentist we made Ayurveda center next. And then I made it like little Indian style some stuff, and then I brought it. I all report in this Tada salon. So I have two this treatment room, and then we having this OPD and this we have inside interior like this. Next. Actually, he just now explained he is actually our CEO or cousin. So he developed and. What Ayurvedic have to what cancer have to have integrated medicine. Actually, he is my guru and he is most famous in Korea, like who's developed integrated medicines. So actually, he is modern medicine doctor, but he did even Korean medicine, even degree he have. So he was in Hensel University. He is professor actually. So he actually invited him to work there, and then because of him, I entered this hospital. So. And then this nephew, our old CEO, nephew, he's actually surgeon also. Actually, they are all modern medicine doctors. And then this is actually when I was 2016 in April. Actually, he's my brother also. Actually, he also studied with me in India, and he came with me, and now he's handling all our hospitals. And actually, they are in nutrition also. Actually, this is only for cancer patients. It is 2016 that time, but now we are all members there. Physiotherapists, and then we have lymph massage people, and many of them we have big team we have.
Explain the meaning of this.
Which one? This yeah, this is loud. I don't know Indian we using this, but in Korea we using this. Yeah, loud. So actually, when I enter in our hospital, actually people, doctors, non-doctors, they don't know what is Ayurveda. So in our CEO asking me to explain what is Ayurveda, what you're going to do in here. So every week of some of our teams, I was explaining to non-doctors what is Ayurveda. So usually I was taking lecture at this. And I'm teaching even one very big integrated medicine department and hospitals we have, and then university. Actually, my Guruji is the head of that, so I was teaching, even Ayurvedic medicines and what can do integrated medicine together. So I was going to lecture also. So next. And many are like seminar or somewhere, so only I know only Ayurveda, so I have to, to introduce Ayurveda in every some big seminar or whatever, so I was making my kind of seminar next. Yeah, this also kind of like group studying kind of things also we have this. Yes. Yeah, how to make this modalities, how to make something, how to give treatment, and how to manage everything this kind of class also next. Actually, what I'm doing in our hospital, I can't say like I'm treating like cancer, but what in beginning when I was 2016, I don't know even what is cancers. But what I now is 8 years now, and what I can say, what with Ayurveda can do with modern medicine is after chemotherapy or surgery or radiation, whatever. So after that, what kind of patient lifestyle or quality we can care? Because Ayurveda in our ancient book in Vedas, mainly is lifestyle and how to every seasons and how we can to live life. So that I actually try to do in our hospital. So actually normally common symptom of cancer is like that. But what I see, this is our the prakriti, as you say, this is like watas increase. So then I understand it. Okay, so usually cancer patient or who are sick, they have this kind of the symptoms. So I found it. So I want to balance of this. So next. So mostly actually this is one of the case, and the patient is actually have lung cancers and separate to other place also. Actually she tried it many antibiotic medicine also and cream also, and but it's not healing in modern medicine that steroids also not working. But only this is only 3 times or only applying that medicated oil, it become like this. And next. Even this is a head. Actually, she taking internal chemotherapies. So like name called Iresa or some geotrip, some kind of internal chemotherapy medicines, and they are having lot of skin side effects. But they tried it in modern medicine, but it was not working. So this is many cases of the patients are giving treatment. And actually in Ayurveda it's very easy to do this care of this. And then actually many people have the skin color different complexion and is not going to hair. But we are very easy to even recover this. And next. Usually we actually in Korea we using even internal medicine also, but mostly it's the same kind of quality we use externally. So this is very easy to and then give the treatment to patients. So they are not only for treatment, they are mentally and they are very relaxed and they are inside healing is very good for this Ayurveda. Actually, you also having in Ayurveda only like thinking about massage, but we are not giving like as massage spa. So it's medicate proper doctors we giving to proper everything. So that we are actually in our hospital and even in 2016 we are calling to actually I cannot do alone. So we call to Ayurvedic doctors from India only. So 2 people coming every 3 months. And we started this, and actually we are not giving treatment just therapists, because therapists they don't know what in India, so they don't know what is body and what is disease. They just doing this actions, but I don't want them to do this, because the cancer patients already they have operations, already they have too many kind of the side effect, and they cannot understand this. So that's why I decided I have to do all myself. So I have to check all my hand, I have to see in my eyes. So I studied even like therapies, everything in my hand and with my doctor. And then next, and then even this is for best for insomnias. And when they are having some scaredness and they are worried or whatever they have, internal, they are having mind, and it is very happy for them. So even insomnia, what they are taking is medicines, but it's not working. So only 3 times or something already they are starting sleeping, and this is really happy for insomnia. Next. And actually, even when they taking chemotherapy or something radiation, and they will have few problems, and they can. Some people have brain these tumors or whatever they can't see, and something seeing difference, and it was very helpful for them also in eye and whatever they get chemotherapy side effect, they can something good for few and something redness and all we can do this pasti, and then even something they can hear or something that who do ENT kind of theory, and then we can do this next. And then actually, maybe in cancer patients, they are very weak, and because their digestion is totally poor. So actually, in Ayurvedic, we are focused mostly is stomachs and then digestion. So, and then we are giving even this kind of in botanic kind of this, and then we are giving to nutritions by our this herb or rice powder or whatever. And then one is like a pain killer. So we are giving to different kind of material, and we are doing different procedures. consultation. So we are doing two kind of this. And next. And this is also when they have back problems who are having like other cancer, kidney cancer or pancreas cancer, they have a lot of pain in back. So we are giving to this kind of cardiovascular in back. And this is one of lady having this uterus something cancer, and we are giving their area also this. Next. And actually, you know that usually that cancer patients always have constipations. So even they're taking modern medicines, but it's not working. Actually, the patient is my pancreas cancer he have. Even he taking modern medicine, it's not coming 20 days usually. And when they are last station and they cannot have go anywhere, very difficult because they are removing cholesterol. So only we giving like 200 ml or 150 ml of this Ayurvedic medicated oil, or it will be very smoothly like 2-3 hours and it coming out. And patients not even paining in their stomachs. So it's really helping for constipations for cancer patients. Next. Actually, woman is also some lung cancer or something about obesity people or something we are giving even woman in this. And next. And we mentioned also like who are having lot of skin side effects or something digestion problems, so we are giving mention also. Even Nasaya is very helpful to ENT kind of cancers. And when they after operations and when they sleep and everything is dry and they have to continuously have water during sleeping. So when we giving Nasaya and something they are very easy to it's not dry, and then this is Nasaya is not only for ENT, in their mental also. So they also make them calm and they can sleep well. And then next. And this is also like whatever having knee paining or something, we are doing this kind of.
In Sanskrit, the Janu means knee. Don't take it otherwise.
Yeah. So many patients always, usually even chemotherapy, they making lot of side effect is paining, joint, lot. So really the Abhyanga is a lot of helping, but this is really helping for anybody of side effect. Yeah. If this is not only old age, this ovarian cancer. No, young age who have breast cancer patient also when they after chemotherapy they become like old people again. So they need this kind of treatment. But that painkiller is never healing to them. So we are doing this next. And this is our doctor, so we are doing like she having this uterus, she already removed and she having always going bathroom many times, and so we are keeping like this. Next. And this is something people who are really needed obesity, and we are doing that powder kind of, we are giving to some different kind of treatment. Next. And this also kind of immediately improve, so different kind of technique we are giving this treatment.
In this, actually, we put a lot of oil
Oils,
over the
very
body.
expensive treatment
Yes,
actually.
it's a very costly treatment, but
Yeah.
the thing is this, for the regeneration of every cell, so we do this.
Actually, I explained already, our hospital is not only inside hospital. I'm trying to use, our whole environment naturally. Actually, in Ayurveda, we have 5 proper, this name called Panchamahut, and then air, and then earth, and fire, and water, and space. We are using 5. I'm trying to use 5 properly, this source, because in human we have this 5 properly. So in our way, I already explained, we have very nice air first, because we have, maybe that in cold area we have point kind of, trees there. There is more oxygen is coming. Not every tree have oxygens. Some especially that tree is not giving high quality of oxygen, and same time this pistons. You know heard about, so they're also very high. So in my area is best in Korea actually. So that's why I choose this hospitals for
Tell the name of the
treatment.
tree. Tell the name of tree.
Tree,
Not
yeah, name
Japan.
for
Japan.
himoki. Do you heard about himoki?
Hinoki.
Himoki chabuji or some smell
Japanese
very
tree.
nice.
And one fellow implanted more than how many trees? No, in lakhs.
300.
Whole mountain.
One mountain he created.
Now this is the forest.
Yeah.
He erected the forest.
Yes.
So that area is most pure.
No, he is Korean.
He is good.
Bought all trees from
Japanese.
Japan and erected here.
Actually, just above our hospital have big temples. So actually, I'm Buddhist, and then in the morning, actually, usually patients asking me, "Mom, what are you doing in morning?" And then we want to follow you, how to manage your health. So I say I'm going in morning in just front of it because I'm living nearby, so I'm going to worship in morning. So 5 a.m. I just started myself and they are following me. So it was 10 people always going or 20 people going every 5 a.m. And then we start 1 hour worships. And that is actually for them to their care their mind. And then in 6 o'clock, just in below the temple, we have very huge, this yoga
Just
meditation.
inside the
rooms there.
campus,
Yes.
close to the
Yeah,
hospital.
yeah. Just
Next to
the resort side, and then upper is the temple, and just down we have very huge this yoga center is there. So actually, it's difficult to teach to cancer patients yoga. Actually, anybody can teach normal people, but very difficult to cure or treat giving to teaching cancer patients because they already have too many operations and they already this lady is pancreas this thing, and then she every chemo here.
Chemo.
And then also still they are doing yoga treatment. Because actually I'm doing hot yoga here. Because in morning actually the weather is little cold. So I put here down this like boiler is very heat. So they are feel like in cancer patients are very low temperature. So I put it very warm and heat, and then they start very sweating a lot. Because in Ayurveda we have svedana is most purifications in our body. So that I'm using same times. And then we doing meditation, yoga, and inhaling breathing exercise at the same time. And then actually they are not looking for cancer patients. They are doing more nice than normal people. So what I wanted to
You see.
people to
She is very pro yoga. See the beauty, how they are doing. Everybody same movement.
For more than 60 years, most of the patients are.
These are your patients or
Yeah,
Yes,
my
all the
patients,
patients.
cancer patients.
They are from the-
patients look very healthy?
Yes. Actually, I'm teaching very strict so because the yoga not supposed to be something another pose, so have to be proper also. That's why they doing very well. And then some people they are every day they practice long time me, and every 6 o'clock they own themselves this they are doing nowadays also. So they are not good special, but their lifestyle is following properly Ayurvedic, this dinacharya means daily routines properly. So they are maybe very post-stage. They are not only having one cancer, 2, 3, 4 cancers they have, but they survive like 5, 4 years. And one of that lady is this properly pancreas, very high level everywhere, so when she lived 4 years half. So because of that kind of lifestyle. Next. And even we have proper this for cancer patients. Not only nutrition over there, and how when they finish this operation or this stomach cancers, they have a different kind of giving food because we are thinking about that their digestion. So we have different. This is I put just the Indian style, but we have proper like every the patients that individually. Yeah, next. And then after 5 o'clock, we doing to that worship or something. Christians, they are doing all their Christian things. And then Muslim, they doing Muslim.
This is
Yeah.
trekking path.
Yes.
Yeah, mountain
Yeah.
trekking.
We are using all of our hospital area. We have many this area to climbing mountain. It's not high like street, but we are very normal area. 9 o'clock, 6 o'clock we do yoga and 1 hour yoga. After then going to hospital, and then they taking breakfast. And then 9 o'clock we are going to climbing mountains. So we having our hospital car and we are dropping not only one place, different place for jogging. Next. And actually we have oceans. And actually west side we have little mud, and to have airs is already have too much mineral.
Mineral.
So we are taking mineral and this wing from there, and then we are using this environment, and then they doing here meditation
Same is
also,
what is
and they using walking in this sand, and then they're doing this in ocean therapies. And next. This is, we have Jakuja, I told you the Geromanion, the spring, the spa. So inside we have a huge, that place. So each cancer patient shape actually breast cancer, we are giving them for this little Korean traditional, that therapy things inside the water. Yeah, it's not chemical water. It's a spring, this pure Geromanion water. It's warm water actually.
Hot
So
spring.
hot spring. So we are using for cancer patients and treatment. And next. And actually, I'm using, Ayurvedic oil, Ayurvedic or something raw materials. I'm trying to make what they are using, like usually soap and then shampoo or whatever. So they have to be not have the chemical. So I'm avoiding to them to use it any something chemical things. So I'm making with them to use Ayurvedic these things. Next. And then I'm using even in our areas have very big, beautiful temple are there, like ancient temples. I'm taking them there, and then always we are having their tea meditations, and then monks are explaining how to live lifestyle and don't have to worry about whatever now you have situations. So monks are teaching them also.
So spiritual healing segment.
Yes. Every month, or I'm taking like picnic kind of. So I'm taking with them. So anything we're doing art kind of also for this nerve systems to improve. So we are doing this kind of thing also, and even something enjoyment dancing class also we have it. And actually, these patients are continuously like 3 years, 4 years, 5 years. And actually, in Korea, insurance is when we have cancer, 5 years you can use it, till you are cure your cancers. So 5 years since then they can stay in our hospital like 5 years. So and patients they are all these old cancer patients actually they are feel like at home. It's not like the hospitals. And we want this cancer patient life is longer, and same time they have to have quality of life. That is our purpose. So next, and actually we have farm also like a mushroom and something different vegetables. We are growing with patients, and we taking them into that food also in our immediately food. And next.
Indian doctors are there.
Insulated.
Actually, So actually, patients are very happy. With even Ayurvedic, usually modern medicines don't have attached, the patients. But in our Ayurveda doctors, we are very good with the patients because we are treating really humanity. So they are really loved Indian doctors, all the times. And then actually, I believe who giving treatment, doctors supposed to be happy. We are not happy, we can't give that kind of energy to patients. So I love to, always, doctors supposed to be happy, their life first. Next. And then when they are coming to our hospital, like 3 months, 6 months, they are coming again. So we are like same kind of integrated kind of, the program. So he teaching them also, and then I'm going to teaching them also. They always taking even integrated medicines, and then certificates they take. So every 3 months or something they come in. Yes. Yeah, this is also our this embassy in India embassy. Yeah, so we are invited actually. So we visit many there. So this is a photo of Anshuman. It suddenly come from had in the sky. So I was really happy and surprised, and because of him I just came here also. And we had an MOU also, and then. We have discussed what in future what we can do in our hospital, and even next month again he came, and then we want to continuously to doctor coming. So we have Dharma Ayurveda hospital clinic, then our hospital we did MOU also. So now we are December again doctor will come continuous 2 of female doctor will come our hospitals. So actually I want Ayurveda. Actually I have a lot of experience in myself, but I cannot explain without papers. So what I decided, and Ayurveda also need proper scientific, this report and this research. So actually, he is my patient. He is actually most famous scientist in our country. So he developed very huge, university in scientist nearby our hospital, and he tried it all medicines, even Korean medicine or modern medicine. Actually, he's not cancer patient. He's normal patient, but he looked like stomach cancer last stage. Only bone was remaining when he was coming to me. So 1 month half, he admitted in our hospital, and I give to him proper this panchakarma, like purifications, because for his digestion was really poor. He feel hungry, but his stool is proper, but cannot accept.
I'll explain his history. He was misdiagnosed as gastric carcinoma stage 4 by many of the modern hospitals in Korea, and nobody is able to do biopsy and prove it. Means that was not cancer. But day by day, ultimately he became cacaxic. He was a very good scientist, very famous scientist. Became cacaxic. Ultimately, it was irritable bowel syndrome with malabsorption treated by Ayurveda. Completely treated.
Yeah, and then he went to Korean medicine, but it was more worse. So he's got some relative, and he visit our hospital, and I give treatment properly, and then I just want to introduce scientists to what is Ayurveda. So I want to research. So I told him when he's coming beginning, Hippo, I will make you to cure. Please to invite you to our doctors. Ayurveda to introduce your scientists. So that time he came, he called him, and then we went to many kind of big seminars.
These all are the modern medicine doctors.
Yeah, doctors who are
and
doing
scientists
research.
who are doing
And
research on the cancer.
all big university, the doctors who are researching. So Seoul University or Yonsei University, all doctors who are there, even Korean medicine, who are doing this research. So he was explaining about what is Ayurveda, and this is Korean. What do you say? Korean medicine, where is the government, this doing research, big center. So we also visit there. Actually, Korean medicine and Chinese medicine and Ayurveda is really common natural medicines, but somehow they are really, because we are similar. So many things are similar, but actually Ayurveda have more deep and more different kind of treatment, totally different. So there was
It is more systematic and properly documented, other than the Korean medicine and Chinese medicine. So they want to understand what is the thought process behind Ayurveda. So we gave the understanding. So they came to know that it is a more scientific and documented way to understand any kind of traditional science.
Yeah, actually, we are independent is same, in India and Korea also, 15 August. So we were selected in the scientist, university.
Mukul was
Yeah.
Mukul.
Yeah, he grew in Korea yoga actually. In I think
Is
1970
He's
something.
from Calcutta.
33 years he is there. So
Now he's Korean citizen.
Citizenship of Korea.
Learned and passed level 3 exam of Korean, and he took yoga to Korea.
Yeah. Somehow.
But nobody in India knows him. Everybody knows Ramdev.
And he is having a very big group of scientists and researchers there who are understanding Ayurveda and yoga in proper way. And it is ISRK is his group.
Yes,
So when
yes.
we-
Indian scientist students. So
Yes.
they are maybe called this
ISRK.
ISRK. So here with the kind of share. So we also to visit there.
Even Korean government listen to him.
Yes.
Yeah.
Whatever he wants to discuss something related to
Ambitious.
yoga, Ayurveda, call him Mukul Basu.
Yeah. So even university, what they have, something different kind of research centers. So we visit there, and they want to.
They are having highest database of the dementia people. They are having medical college, so they are having the highest number of more than 2 million patient database of dementia. So we are working how Ayurveda can help in the dementia in a palliative way, and in this way we are having one research project there.
Yeah. Actually, somehow, what is different? Just modern medicine and Ayurvedic medicine. What patients have recovered is mind, and then what they have to understand themselves. That is Ayurveda treatment given together. We are not only deal with human body. We are deal with their mind and their souls. And they never think, people cancer. When they get cancer, they are thinking about that. So they want very going to truth. So Ayurveda is wisdom of life. So they are very happy to giving treatment themselves, and they are really covering and they are curing all themselves. Even they are going to pass. They are very happily they are going to pass also. So that kind of lifestyle, not only cancer patients and every human have to live, like this kind of wisdom life. So I'm thankful to to share my experience.
Now session is open. You can ask questions related to presentation as it is, but I think few of the young girls, they joined the session because the topic was beauty and health through Ayurveda. And moreover, there is a cherry blossom of Korea on top of it, because Korean is famous for aesthetic products,
Yes.
cosmetics, and beauty.
Actually, I didn't decide because the title beauty. I said I'm not Miss Korea, so I cannot talk about beauty.
Right.
But actually, Korea beauty is like we are too much putting makeup. That is, what our beauty actually. But what I think beauty is inner, side. So yeah, how can glowing skin is when your body water or your blood quality is showing to your skin. Skin is just cover our body. So when you see that skin, it means you are healthy, can see everything. So you also have to follow your cultures and your wisdoms. That's it.
Any questions?
Any questions? Please.
Do you have any opening in critical care medicine there?
He is a critical care director of our hospital, looking after intensive care patients. He is asking, do you have any opening in your Wilmark City hospital? He want to shift for AQI 0.
It's not my
Ma'am is asking some question.
No, I'm not asking any question, I'm just speaking a heartfelt feeling and expressing. Feeling great.
Oh,
We have a saying in India, घर का जोगी जोगड़ा, बाहर का जोगी सेव. Which means the people who literally started all this over here, they have no value. And once you come from outside, there's a lot of value. Look at the faces of everybody. Look at it. Everybody's face is same. So when you talk to them this, they're very happy. When I talk to them this, they may not be happy. You never allowed me to do that.
yes, ma'am.
Since you have knowledge of both Korean medicine and Ayurvedic medicine, and many of us sitting here have no knowledge of Korean medicine, but we do have, some of us, having read a little bit Ayurvedic medicine, and then we could ask you, if you were trying to integrate the two, what are the areas in which Ayurvedic medicine and Korean medicine can integrate to come up with a new field which would work out?
Integration, ma'am, actually is also part of that discussion. Modern medicine means our system, Ayurveda and Korean, all three they are planning to integrate. Without modern medicine, they can't do scientific data collection. Yeah. Without that, it's impossible, even for Korean or for Ayurveda.
You see, the thing I was thinking of when you presented, the problem with this Ayurvedic medicine is there's too much of non-scientific input in it. And anybody gets up with a little good publicity, becomes an Ayurvedic expert.
Because thoughts are more common in Ayurveda.
That's it.
Yeah.
So, if you got this and we bring in and you've been exposed to this, I would think you could bring together these two and come up with what areas would be best treated with Korean and what areas would be best treated with Ayurveda. And the integration of that would be something that you're thinking of.
But ma'am is because ma'am also worked for US as well as AIMS. I showed you yesterday. When you are integrating all the three systems,
you just point out subset of diseases where which medicine is working better and document it, publish it scientifically. Right, ma'am?
Yes. Ma'am, actually we are doing in the same way. For the degenerative cases and for the geriatric care, we are doing this. And for the palliative care of the cancer also we are doing it. And we are documented and we are having proper SOP of every procedure. Like she is doing Abhyanga for the cancer patient, so we are having proper SOP for the how to do Abhyang, which oil will be used, in what manner we are going to do, and how it is helpful, and what is the scientific approach behind it. In this way, we are doing all kind of therapies, especially for the palliative care of the cancer, degenerative care like osteoarthritis and most of the degenerative cases and geriatric cases. In these three areas, we are already working. And it will be very helpful if we integrate in that manner. Suppose with the in geriatric segment, so most of the patients who are having degenerative properties, so in that area we are working, and that integration and scientific approach we are making in a club manner. So they are taking some medicine also for the other elements, and in clubbing we can represent this Ayurveda helpful. Ayurveda medicine is helpful in this way, because we never used to give any internal medicine in South Korea right now. But in India, we can introduce in that way also. So we are going to introduce the nutraceutical segment. Like in dementia, we are using cow's ghee in that way, in a proper specific dosage format according to the biotype. As she mentioned, Prakriti, and now we are doing the clinical trials over it. So after the clinical trial, we can publish paper here also.
But I mean, not knowing too much about Ayurveda, just knowing that there are people who think we're working on. I was thinking that this would be an area in which we could have a fair amount of common interest and come up with something that would be helpful to so MBBS doctors.
Right. Like chemo side effect, we are doing a lot of patients. We are doing in chemo side effects segment, because their patients are taking chemotherapy, but they are getting so many elements. So with the help of Ayurveda medicine external treatment, we are getting very good result in this. So it can be a common interest segment.
Any question from your side?
Are you doing something, Dr. Tiwari, are you doing this for you? Doing something like that in Bhopal also?
Yes.
Bhopal is yeah.
So we are having specific degenerative center there.
When you are giving this Ayurvedic treatment, along with the Ayurvedic treatment, patient is taking the modern medicine treatment?
Yes, they are admitted in the
Actually,
hospital.
all
also.
cancer patients have actually all their modern doctors are away in Seoul, the hospital. They are continuously actually they are doing chemotherapy actually. They are not just free.
I'll explain that. Director of the hospital is Dr. Vaughan. He's a general surgeon, especially doing coloproctology. I explained him how we can do SOP. In SOP, there are two heads. One is a standard treatment only. One is standard treatment with Ayurveda. Two arms. Then compare the two. Like for example, small MRI has been done, radiation, chemotherapy. Now, how is the scar in second arm? How is the scar in the first arm? Means everything first fix it so that you can compare.
But they are doing only the external therapy.
In South Korea, it is not
In
allowed.
South
sir.
Korea.
Actually,
Internally it is.
this
In India, we
company
can do.
and this the food material is Ayurvedic medicines.
And
so
nutraceutical we are
that
using.
kind of like a turmeric and
But as she explained you, Ayurveda is not only medicine. It's lifestyle changes like meditation, yoga,
Balancing the thing.
balancing
But
everything.
Ayurvedic is for chronic disease only.
Yeah.
There is nothing.
No, sir. Right now we are doing in that. So we are having confidence over this, and we can say these are the
But
area
is
we are
there any
weakening.
treatment for acute disease in Ayurvedic too?
Sir, actually, right now we are not doing, so we cannot comment on that.
No,
So
no, his
right.
question, I'll tell you. His question is, the purpose of integration is, for example, some patients come with myocardial infarction. They will not claim that I will give something like Sorbitrate or NTG, it will open up. No, go for modern medicine. That is integration. And what we can do, the second heart attack we can stop. Change your lifestyle, change your cholesterol thing, inflammation, everything. That is possible. Some is coming with an accidental trauma. Sushrut documented how to do surgery. Means surgery will be there. Done by modern medicine doctor or Ayurveda doctor, there is different scenario. Then what Ayurveda doctor can help you out? Fibrosis, neuropathic pain, recovery, they can help you. Integrate those with treatment at the same time.
You are giving chemotherapy, you are using Ayurveda, and you are using yoga also. You are using three things.
Yoga is part of Ayurveda.
Sir,
Yoga
actually
is not
we are-
separate.
That is the lifestyle.
Right.
Alive.
There are persons who are doing.
Their purpose of saying Chinese, Korean, listen, I'll explain you first. First you have to understand what is Ayurveda. There are many traditional medicine of many countries like Chinese, Korean and Indian system Ayurveda. Korean and Chinese they are sticking only to herbs, right? In Indian system lifestyle means yam, niyam, asan, pranayam, pratyahara, dharana, dhyan, samadhi is part of Ayurveda. What are you thinking? Wake up like early morning, dincharya is part of Ayurveda. Without that, Ayurvedic doctor is not going to give you any pills, any oil, nothing. First change your lifestyle, including yoga. That's part of Ayurveda.
From what I know a little bit, nothing, just personal experience. Most of the time when you go to someone with Ayurveda, they will give you some things like that.
Right.
Now that's to me a modified stuff. I'm trying to see what, and the first thing they tell you, oh, you have to stop all allopathic medicine.
Oh, that's
They
wrong.
do that a lot.
That's wrong.
Sir,
I've
actually,
seen it being done. The question I'm asking is, from what I've understood here, is that actually you need to do everything together. Now, what are these things that they're giving you with these little puyas?
actually, ma'am, the thing is what question you are asking. Actually, problem is this: it's a personal thing. Actually, Ayurveda never mentioned in this that you have to give all the times and you have to stop all the allopathic medicine. Even in Ayurveda, they have mentioned even the chemicals if the person is taking, how to reduce it, and how if it is useful, then how to balance it. This is also mentioned in some texts years back also, when there was no modern medicine also. But they have mentioned such kind of mineral if you are taking, if such kind of chemicals you are taking, then also how to balance it. But they interpret in a wrong way and they are presenting in that way that you have to stop everything in this way. It is a kind of rivalry they are actually using. It is not for the humanity. Yeah, it is not a part of humanity. It is not a part. It is not a part of wisdom also.
Try to understand, is there no defined line? This is modern medicine, this is Ayurveda, right? Digitalis, we got it from Ayurveda. L-asparaginase for blood cancer, got it from Ayurveda. Now, Ayurveda people calling L-asparaginase chemical, they are not aware. They are idiots. They never read the books. L-asparaginase from where they have extracted. Now, if we are giving chemical, what is chemical? Any rasayanic tattva? Hydrogen, carbon, nitrogen, oxygen. It's present everywhere. It's not chemical. Don't call it chemical. Means integration doesn't mean बाउंड्री के चक्कर में नेता लड़ते हैं मैम. हम लोग डॉक्टर हैं, हमें बाउंड्री खत्म करनी है. पर्पस ऑफ दैट
बाउंड्री खत्म नहीं करते हैं.
Exactly. I totally agree.
डॉक्टरों ने बड़ी बाउंड्री
Exactly, totally agree with you. My whole purpose is telling that only. Why we are fighting for boundary? It's not a boundary. It's all human science. It's not medical science. Human science.
I've been through that.
Yes. So it happened because that's why we are awareing everybody now, and we are having in Bhopal actually we are having center to train the Ayurvedic doctor also. They should not use such kind of words. They should understand the human segment. They should understand the modern medicine also.
They listen to you.
They are listening. No. Yes.
Yes. Your question.
Ma'am, what I understood is modern medicine and Ayurveda are trying to improve the quality of life to patient in
Immunity.
Yes.
Yeah.
So, ma'am, can you just tell me what kind of patients, what kind of income strata patients can be, what kind of a setup we can start so that these patients can be treated? Can all profile patients
No,
can be treated
for
like
that,
this?
India Korea is different.
That's
100% insured.
Okay.
And even this treatment is also covered. In India, only 7% people are insured.
This facility can be taken advantage of by all income people. Or you're just
She's
taking
asking
to a
how we
high-
can start in India because cost concern is there.
It won't be possible.
She-
Actually, even our hospital also, the program is free.
Yes.
Because they are actually in our insurance when they have cancer, they're giving lot of money for cancer. Like per year, you can use $5,000, no, $50,000 per year. Can use
Yes, 50,000.
very huge business. So that patient, one patient is every year that much money. So everything is modern medicine actually. But somehow Ayurveda is helping to live with the patients to covering even this very side effect or something like
Rehabilitation.
that things we are covering so that people are happy to use more modern medicines at the same time because always cancer patients taking these injections and they are somehow they have some chemical toxin also so that things also we are removing
Actually, in India, you can set up in a rehabilitation segment, like you are having physiotherapy segment also. For that, actually, we are working on. And we are working with Apollo also regarding this. So how we can integrate this segment. Because rehabilitation segment and the kind of supportive treatment, we can give them a name, a supportive treatment, and we can definitely integrate. Because well-being is one of the segment, and well-dying is also one of the segment. Because they think they are about to die, but they want to live their rest of the life in a good way. In this way, we are working. And
even chemotherapy, you know that if you are not having proper your health, they cannot continue chemotherapy. So what we are doing is that cancer patient have to do continuously chemotherapy. So also we are helping for to their immunity. That is actually main in our hospital also. It's not only to have some natural medicine. No, we are helping modern medicine continuously follow.
And we are giving consultation over the how to how to improve their lifestyle in a proper way, how to wake and all these things. Such kind of sessions we are taking for 7 days, and we are training. These are the doctors who are coming. They are coming from the India, and we train them here, and we give the similar kind of SOP, so that they can use this in different patients. And they are using it, and the patient are getting extreme good benefit. And we have completed 6,000 patients till now. So actually, the very difficult cases like pancreatic cancer of grade 4 also. So they are just taking the palliative care in that way. But the thing is this, in India we have to find out whether this is coming, because the Apollo are saying that we will admit the patient and we will put in the supportive treatment. So in this way maybe some result will come.
The biggest issue I see in our country for this is the fact that money is good for the body. Our patients have already exhausted most of their money in the chemotherapy. And some of them will finally give up even taking that.
Yes.
And to add something on makes it a little bit of a problem. And mentally I'm sitting here thinking now, how do we overcome this? You see, South Korea is in a happier situation. Where
Some short programs we can introduce definitely.
No, Shant, I agree. This South Korea is ideal situation. 100% insurance and unlimited insurance kind of thing. Free. For cancer patients, free. But what if we actually calculate cancer economics, in that condition, if we introduce the same thing, at least for the chemotherapy patient or radiotherapy patients, ultimately it will be cost effective. The reason being how much patient is spending on this treatment, ultimately giving palliative morning, evening, or any medicine as anti-emetic is stopped. You are saving money there and spending only 10 to 12% of money in this. It will be in cancer way cost effective treatment if you integrate.
Right from the beginning.
Right from the beginning, yes. It's not a worse condition.
Let's say if the medical oncologist wants to earn and earn and earn and earn from just
Man, they will earn much. I'll tell you again. How? I'll tell you. One group of, for example, one group of medical oncologists is spending 5 lakhs, for example, and still patient is vomiting, cachexic, malnutrition. One group of medical oncologists is spending only 3 lakhs and patient quality of life better. Patient will come much more in that group and volume will increase. This is simple. उसके लिए थोड़ा अहंकार छोड़ना पड़ेगा, अहंकार उनको छोड़ना पड़ेगा, अहंकार छोड़ना पड़ेगा, इसलिए छोड़ना पड़ेगा कि सब कुछ हम जानते हैं, इससे निकलना पड़ेगा, सब कुछ हम नहीं जानते हैं, still we are अज्ञानी, कुछ नहीं जानते हैं, सच ये है।
I just give you an example.
अब ये जो जान रहे हैं ये ठीक है?
कौन?
इसके बारे में आप श्योर हैं?
किसके लिए?
जो हम करेंगे ये ठीक है?
इसका जो साइंटिफिक डाटा वही कर रहे हैं।
साइंटिफिक नहीं है।
साइंटिफिक डाटा।
नहीं, बहुत सारे उन्होंने कहा है कि भाई तेल मरने से ना इसके सेल रीजनरेट होता है।
They're using our language.
जो
Sir, we are having modern evidence. Sir, we are having the papers office.
It was based on a lot of evidence.
Sir,
No,
listen, sir. So when you say, listen, sir.
Yeah.
So when you say any, listen. So when you say any scientific data, what you do, you present one paper, you put one paper. We are having also journals. We have put it that paper along with the database of the 30 sample size and how the rejuvenation takes place. That cellular study also we have kept. It is not unscientific. We are not saying something.
There are many
You combine
scientists.
so many things that you are getting result from which
No. In that patient, it was not there.
Prashant, what he's asking regarding scientific study, that is the purpose of randomized control trial.
Yes.
I'll tell you, I'll explain you because I have drafted this with kind of double blind study, number one, and number two, one arm is control arm. You're getting only a standard treatment by modern medicine. Another arm, that is standard treatment, same subset of patients, along with addition of whatever you want. Means not all treatment of Ayurveda in all patients, no. Some requires Vasti, some variation, some Nasya, some something, or mixture of that. In that condition, now you compare the result of both the arms in the course of end of life, survival, quality of life, everything. We have parameters. If you are getting a statistically significant result in the second arm, then only we can say it's a proven. That is the need. There are many scientific and modern medicine journals. Like Nature is the world's most advanced journal, and Calmeg, role of Calmeg in anti-inflammatory property, immunomodulation property has been published. And you are liking Calmeg because of test. You will Calmeg is a Ayurvedic herb, but for test there will be no paper, right? But for anti-inflammatory property, there must be a paper, right? Because test will come under nutraceuticals. Nutraceutical doesn't require many of the papers. Therefore, when we talk about integration of the system, without science we can't go. Science is the only answer. We can't be bhakt. We are not bhakt.
Let me share with you. We have two patients over there who come from
NHPC,
hospital.
Max.
Two people have come from that hospital. 1 crore rupees already paid to Max for one patient. 80 lakh rupees already paid to PS, public sector company. I won't take the name. I won't take the name of the company. Right. They got sick and tired of paying those bills, and they referred those two people to us. Patient number 1, who's still there. The day he entered, he had a tracheostomy tube, he had a feeding tube, his hands were like this. He could talk, he could walk, he couldn't do anything at all. Thorough examination, whatever they did. And finally, I went in the evening to see the patient. And I said, 10 दिन 12 दिन दे दो, आपको चला के दिखाएंगे, आपको खिला के दिखाएंगे, आपको बुला के दिखाएंगे, 10-12 दिन. The family has abandoned the person. वो बेटा जो है वो बहुत लंबी लंबी बातें करता है. एंट्री के वक्त कहता है 3 महीने का परमिशन ले लो इसको दाखिल करने के लिए यहाँ पे. हमने कहा 3 महीने का, हम तो हफ्ते का भी नहीं लेने को तैयार, हम तो हफ्ते का भी लेने को तैयार. Within 48 hours, that guy is walking with the walker. We have a video. He is walking with the walker. He उसकी tracheostomy tube निकाल दी, उसने हाथ यहाँ रख के, he talks to me every day. Third day I went to him. ਤੁਸੀਂ ਪੰਜਾਬੀ ਚ ਨਹੀਂ ਬੋਲ ਸਕਦੇ. ਤੁਸੀਂ ਖੰਨੇ ਹੋ ਪੰਜਾਬੀ ਚ ਨਹੀਂ ਬੋਲ ਸਕਦੇ. Which means you are a Khanna, you are a Punjabi. Why can't you talk to me in Punjabi? I said, okay, I'll talk to you in Punjabi. So we started chatting. उसका मुंह खिला हुआ उसका मुंह. क्या बता शॉल तो मेरे को भी है क्या? हम करेंगे शॉल. He said, I also have this shawl. कितना खरीदा? From where did you buy? So I said, bought it from Srinagar. मेरी पोस्टिंग वो कौन सी कंपनी का है? NHPC. मेरी पोस्टिंग जम्मू में थी तो मैंने जम्मू से खरीदा था. तो मतलब we are chatting. He is happy. He is walking. वो मेरा हाथ पकड़ के मुझे पकड़ के बैठा था. मैं पकड़े रहने देती हूँ. So the word he used was the mind. He has got a servant. छोटा सा servant है उसके साथ. उसके छोटे से सर्वेंट से मैंने पूछा, बेटा तुम छोड़ते कहाँ गया सर्वेंट के साथ, कि क्या फर्क है वहाँ के अंदर यहाँ के अंदर. कहते थी मैंने भी पूछा था इनसे. प्यार यहाँ सारे मुझे प्यार करते हैं. वहाँ मैं बेड नंबर 100 था, मेरे से कोई बात करने वाला नहीं था. सो ही मोबाइल, his tracheostomy tube is out. वी अब ट्राइंग कि उसके वो जो ट्यूब है वो वाली निकल जाए, पर अभी निकली नहीं है। अभी 5 दिन में 6 दिन में उसको आया, 5-6 दिन में तैयार हुआ। सो lot of difference is made in big hospitals, this is a corporate hospital. The medical oncologist, I'm very uptight in medical oncologist. There are 60 patients admitted under the medical oncologist, 10 patients, 20 patients. They walk into the room, they look at the chart. हाँ जी, ठीक हो? I asked every one of them, why don't you examine the patient? All the reports are there. Where is the need to examine? All the reports are there. Where is the need to examine? Yeah, you don't have a need to examine. That guy has a need to, so that you hold his hand.
Yes, sir.
You hold his hand. You talk to him. No, who's the second patient?
Complaint
वो एक और
हार्ट कार्सिनोमा हार्ट पे संजीव बाबू,
हाँ?
संजीव डॉक्टर संजीव बाबू।
वो तो बेचारा उसकी बात छोड़ो।
मैम कुछ भी बोल दीजिएगा मम्मा।
वो कार्डियोलॉजिस्ट है, ठीक है, और उसने अपना एक हॉस्पिटल खोला हुआ है। तू सुना है, ज्यादा बात तुझे
बताओ आप आपसे अच्छा लगा, मैं भूल नहीं, तू बता दो ना।
उसने अपना एक सेंटर खोला हुआ है, छोटा सा नर्सिंग होम से खोला हुआ है। मैंने क्या देखा, बीवी अपने आप को गायनेकोलॉजिस्ट बोलती है, लेकिन उन्होंने बताया गायनेकोलॉजिस्ट नहीं है, एमबीबीएस है। उस बंदे ने कोशिश करी कि अपना कार्डियक सेटअप करने के लिए, पैसा इकट्ठा करने के लिए, दोस्तों यार से पैसा इकट्ठा करने के लिए कुछ किया। एंड फाइनली उसके ट्यूमर कहाँ गया?
हार्ट पैलेट, हार्ट पैलेट, कार्सिनोमा हार्ट पैलेट है उसका, नेक हार्ट पैलेट।
मेडिकल स्टूडेंट
He is working as a cardiologist in JP. Then he got carcinoma heart palate, operated there, JP Noida. Then a radiation was there. Then again recurrence was there. And after recurrence, he was almost mouth opening was reduced, not able to take anything orally, and developed stridor. So he was admitted again there in JP. His wife called me, can you give end of life care in your center? So I said, no ma'am, come. So then she bring her husband to here, and here he was having a stridor. This whole growth was pressing the trachea, and we can see the sound. Then we planned an emergency tracheostomy. Initially she refused that she don't want any intervention, and whatever happening she is fine with that, and she has already accepted the disease and everything. But somehow we convinced her and get her tracheostomy done in this hospital only. Then she moved there, and now maintaining on tracheostomy and on PEG tube, she is maintaining well. He is maintaining well on this.
We would be able to help him because the wife doesn't care, children don't care, nobody comes to see him, nobody wants to spend money, nobody wants to take permission to change the antibiotic, nobody wants to do anything for that. So we see, हम अगर हमारा भी ये हाल होने वाला है क्या? हमारा भी ये हाल होने वाला है क्या? मतलब बीवी को परवाह नहीं, बच्चों को परवाह नहीं। बेटी मेरे ख्याल 1 महीना हो गया उसको आए, बेटी महीने के बाद देखते हैं, फिर वो पहले व्यक्ति में 28 को कर दे रहा हूँ, पहले मैं 28 ले जाऊँगी।